Breaking news. Ebola outbreak spreads in DRC and Uganda. An international response is currently underway to control a serious Ebola outbreak in parts of the Democratic Republic of Congo, DRC, and Uganda. The outbreak has already infected hundreds of people, caused dozens of suspected deaths, spread across border regions, raising concern about further transmission. Health authorities are working urgently to contain the virus before it spreads further. International response and U.S. action. Because of the growing risk, several countries and health organizations are involved in emergency response efforts. The United States government is reportedly preparing to relocate a small number of its citizens who may be affected in the region. International health teams are assisting local governments with testing, treatment, and containment measures. The focus is on preventing the outbreak from turning into a larger regional epidemic. What experts are saying. According to medical experts featured in the report, the outbreak has surprised health officials, suggesting it may not have been detected early enough. Specialists say the current strain and spread pattern raise concern because Ebola can be highly deadly if not controlled quickly. Experts are comparing it with past outbreaks to understand how fast it is spreading, how severe the symptoms are, whether it behaves differently from previous strains. An infectious disease expert also warned that the situation is very concerning, especially if transmission continues in rural and cross-border areas. Why this outbreak matters. Ebola is a serious viral disease that spreads through direct contact with infected bodily fluids. It can cause high fever, severe internal bleeding, organ failure, high death rates if untreated. Because of these risks, even a relatively small outbreak can become dangerous if not controlled quickly. CNN coverage highlights. The report includes analysis from international correspondents reporting from Africa, medical experts explaining the virus and its risks, discussions about how this outbreak compares to previous Ebola crises. The focus is on understanding how serious the situation is and whether it can be contained in time.